social and economic burden of the neurodegenerative disorders on modern society are profound. And faced with an even greater impact in future decades, researchers around the globe are focused on the underlying mechanisms of neuronal destruction common to all of these disorders, the so-called excitotoxic theory of neuronal death. This videotape focuses on these underlying mechanisms, as well as exciting and powerful new therapeutic interventions based on this model, now proving efficacious. Let's start by taking a closer look at the actual incidence of some of these neurodegenerative conditions. We'll start by looking at Alzheimer's disease, and in this report from the Journal of the American Medical Association in 1989, it's quite clear that we're seeing a dramatic increase in incidence of this problem. It's estimated that right now we have about 4.5 million Alzheimer's patients in this country, but if you look at the year 2030 on the far right side of the graph, that number increases to some 9 million. Now, it has been estimated that even right now, the economic burden on Western society, and in fact even in the United States, is some $60 billion a year annually. Now, this next slide is also interesting in that it shows that the prevalence of Alzheimer's disease based upon age dramatically increases, as one would expect, as we age. Between the ages of 65 and 74 years, the risk of Alzheimer's is about 4%. But in the population of 85 years and above, that risk is 50%, and that's a profound finding. That is to say that individuals in our society, age 85 years and above, have a 50% risk of having this diagnosis. And it's in fact even more profound when you recognize that this is the most rapidly growing segment of our society. Now, the epidemiology of Parkinson's is actually quite interesting as well, and also increasing quite dramatically. It's compelling to realize that, in fact, one full percentage of our population, age 65 years and above, actually carries this diagnosis. The mean age of onset of this disease is about 57 years. We want to now explore very deeply the fundamentals of the neurodegenerative conditions and recognize that really what's come to our understanding now in the year 2001 is that what is going on in the brain is that it is actually on fire. Much as we see with other inflammatory conditions in the body that we're familiar with, the brain actually experiences inflammation just as well. The brain, being the center of sensory perception, however, does not itself feel and render us the understanding of pain. We focus, however, and what we need to focus on is actually treating the fire and getting to the root of the inflammation. Unfortunately, many of the current therapies used in the treatment of these diseases unfortunately seem to focus on treating just the smoke. Now, this idea that inflammation is at the heart of these neurodegenerative conditions really is now taking hold in the most well-respected both peer-reviewed journals and even symposia. This January 2001 symposium report that was recently described demonstrates that they're focusing on the role of inflammation in Alzheimer's disease, and even the literature is quite replete with references to the role of inflammation in Alzheimer's disease. We know that in Alzheimer's we have an overabundance of the so-called pro-inflammatory cytokines, and in addition, reactive microglia are seen to be throughout the brain in the Alzheimer's patients, certainly more concentrated in those areas of the brain which are more afflicted with that disorder. We know that the complement pathway within the brain is activated in Alzheimer's disease. And finally, there's a large body of data now that has demonstrated that the anti-inflammatory drugs both are demonstrated to reduce the risk of Alzheimer's disease and in addition can slow the progression of that entity. Now, here's a study from Neurology back in 1997 where they looked at the relative risk, that's the RR on the left of the screen, of Alzheimer's disease in individuals who had taken the non-steroid anti-inflammatory drugs for 2 years prior to evaluation. And here I think it's quite clear that those individuals who had been on non-steroidals were at a substantially reduced risk of getting Alzheimer's disease, down to 40% of unity. Aspirin users as well had a reduced risk of Alzheimer's disease, being about 26% less than the control. And interestingly, the acetaminophen group was actually 35% increased in risk of Alzheimer's disease. And that's important because, as we will learn later, acetaminophen is known to actually decrease the body's production of glutathione. And what we're really going to focus on later in this presentation is the profound role of glutathione as serving as a brain-protecting antioxidant. If, in fact, the non-steroid anti-inflammatory drugs are effective in reducing inflammation, then perhaps one would expect that the use of an anti-inflammatory drug might actually be helpful in treating Alzheimer's patients. And in fact, in this study, published in 1993 in the journal Neurology, a dosage of indomethacin, which some may argue it is in fact a fairly high dosage, was provided. And in fact, as we see on the bottom of the slide, the group receiving the indomethacin actually improved about 1.3% on various neurocognitive evaluations, whereas as expected, the non-treated group declined by about 8.4%. Well, it's not just Alzheimer's disease that's the focus of attention in terms of inflammation and its dangerous effects on the nervous system. In this report seen in Neurology Reviews from 1999, October, can anti-inflammatory drugs halt Parkinson's disease? So again, our attention is drawn to the level of research and commitment now in the scientific realm in looking at inflammation and reducing inflammation as it applies and as it affects all of these neurodegenerative conditions. In this report, it was stated that macrophages, complement, and pro-inflammatory cytokines are all elevated in the Parkinson's brain precisely at the sites of neuronal loss. Now, that really does correlate quite well with the previous slide that we saw demonstrating activation of the cytokine pathways in Alzheimer's disease. This idea that neuroimmune mechanisms are involved with Alzheimer's, again, demonstrates that the microglia, or the brain's macrophages, are activated in Alzheimer's disease, again solidifying this whole idea that it's an inflammatory situation. But even more importantly, we're going to learn later that the profound effect of beta amyloid in enhancing free radical production is intimately tied in with this whole inflammatory cascade. Well, what are the risk factors then that increase this inflammation in the brain? Many of them have been studied. They include genetic predisposition, previous experience with head trauma, transient ischemia or blockage of blood supply, microvascular defects, environmental insults like environmental toxins, and even infectious agents can act over time to increase inflammation in the brain. These increased brain inflammatory processes then are much more detrimental. The process is amplified because we have the production of reactive oxygen species, reactive nitrogen species, and really what's quite important is the induction of so-called toxic genes. And these include the induction of nitric oxide synthase as well as COX-2. These are ultimately the fundamentals of the neurodegenerative diseases. In looking at this report from Free Radical Biology and Medicine in 1999, we know that in our brains, with age, we increase our production of ROS, or reactive oxygen species. But what's really more compelling is the curve of the pro-inflammatory cytokines, which we see actually precedes the production of reactive oxygen species. And that's really quite interesting because what it's telling us is that there may be some causality here. In other words, it's quite likely that the pro-inflammatory cytokines are the producers or the initiators of the formation of these damaging reactive oxygen species. But even more compelling is that once this cascade takes place, we ultimately have a very steep curve of the production of toxic gene products. So when we evaluate patients, and this is an 1874 lithograph looking at a patient who over 3 years deteriorates dramatically from Parkinson's disease, when we see individuals like this even in our modern practices and wonder why they are declining so rapidly, it's important to keep in mind these two previous slides. The first indicating that, in fact, brain is on fire, and the second showing this very, very steep curve where ultimately toxic gene products are produced and patients decline so rapidly. And I think that many of you must have had that experience in your practices where you're treating an individual for many years and then suddenly he or she has a very steep decline, which is almost inexplicable. Well, let's look at the model then, and that is that pro-inflammatory cytokines in the extracellular space enter the cytosol, which then activate these transcription factors. These transcription factors in the nucleus induce so-called toxic gene products by induction of inducible nitric oxide synthase and COX-2. These involve the nucleus and ultimately lead to enhanced inflammation and ultimately apoptosis, or pre-programmed cellular death.